Hi, my name is Tiffany Nguyen, and I'm a second-year medical student at the Oklahoma State University College of Osteopathic Medicine. Today, I am presenting a poster entitled Completeness of Reporting of Patient-Reported Outcomes in Randomized Controlled Trials Focused on Peripheral Nerve Blocks, a meta-epidemiological study. Peripheral nerve blocks are a type of regional anesthesia that is used to lessen the consequences of inadequate pain relief. Patient-reported outcomes are health outcomes that are reported directly from the patient, and these are used to determine the effects of specific treatments. Guidelines such as Consort Pro have been made to help researchers fully report findings within randomized controlled trials so that clinicians and further researchers may use clinically based evidence into their practice or investigations. In our investigation, our objectives were to determine the adherence to the Consort Pro guidelines in randomized controlled trials with patient-reported outcomes related to peripheral nerve blocks. We also wanted to investigate the associations between reporting completeness and trial characteristics. Our search yielded 1,084 trials that were screened. We had a final number of 65 trials that were included in our investigation. These 65 randomized controlled trials were extracted and analyzed using Consort Pro guidelines, as well as the Cochrane Collaboration Risk of Bias tool. Adherence to the Consort Pro guidelines were calculated, and linear bivariate regression analysis was used to assess the relationship between the reporting completeness and trial characteristics. We found an overall completion percentage of 46.8%. This reveals a suboptimal reporting of completeness. There was a significant difference that was found between patient-reported outcomes established as a primary outcome versus patient-reported outcomes that were set as a secondary outcome, and this p-value was 0.035. There was one other significant finding, and that was that the length of patient-reported outcome follow-up between 6 months to a year, that was 16.24% more complete when compared to a patient-reported outcome follow-up that was 3 months or less, and this p-value was 0.006. Patient-reported outcomes allow clinicians to better understand patients' experiences regarding the interventions that they receive. Incomplete reporting was common among patient-reported outcomes within our included randomized controlled trials that were investigating peripheral nerve blocks. Applying complete patient-reported outcomes within randomized controlled trials will allow researchers and clinicians to better understand the effects of peripheral nerve blocks through patient standpoints. Integrating this qualitative data in addition to quantitative data will consequently ameliorate analgesic treatments for future healthcare therapeutics. Thus, increased adherence to Consort Pro statement is encouraged to improve patient-reported outcome reporting. These are the references that we used within this investigation.